Workers are an important part of healthcare. Not only will you be serving diverse individuals in all settings, but you can practice in a range of healthcare. And what I think is exciting is that also in healthcare, that it crosses the whole lifespan. So we're going to talk not just about aging, I talk about aging through the whole lifespan. So, and your careers, for many of you, some of the best careers are in healthcare, but that's a biased opinion, of course. But there's also a lot of job opportunities in healthcare today. So we know that health spending is on the political front. We know that health spending is high. But you know what's disappointing? We in the United States have such high health expenditures. You would think we would do outstanding in every area. But life expectancy is lower than in some other countries, as well as infant mortality is higher for particular racial and ethnic groups. So to be sensitive when we're talking about health, both areas like infant mortality, disease burden can also be higher. And we know that health has a very large history of changing. We know that health is in the forefront today, but it's also been in the forefront in the past. In the 1800s, we did a lot in healthcare. We did a lot with the American Medical Association being established, the charity organizations, and the settlement house movement. Jane Addams, amazing. You've heard about her in your policy classes. She has been a leader in healthcare in the late 1800s, and in 1920 she won an award for all her work with Hull House. But everything she did talked about healthcare for the community and talked about the importance of health and housing, health and neighborhood, health and water and sanitation. She was right there. When we think of Flint, Michigan today, Jane Addams was in there in the late 1800s and 1900s thinking of how important health was to every individual and family. And in healthcare, hospital social work emerged in the 1900s. We have done a lot of work in healthcare today as well as in the past. We continue to build momentum from Martin Luther King. His war and the war on poverty really led for changes in healthcare, Medicare and Medicaid. You learned about it in your policy class. It is what shapes our healthcare system today for many older adults as well. Attention to AIDS and substance abuse in the 1980s emerged, but it continues today. And the Disabilities Act, what has happened with disabilities and serving individuals has been started a lot in the 1990s, but has continued to grow. And triple aims is what is 2000. We focused a lot on not just healthcare in hospitals and nursing homes, home health agencies. We focus on the triple aim of bringing integrated healthcare for behavioral health sciences and for working with individuals in a community setting. We know how important Obama's work is in 2010 for opening up access to healthcare. And right now, today, and certainly we hear from Elizabeth Warren, we hear from Bernie Sanders about Medicare for all, but we also hear other moderate platforms that have talked about different approaches to improving health. The important thing about health is that it is an issue that should be a fundamental human right. It is all about social justice. International human right law recognizes health as a human right. We need to recognize it in the United States. There are many people that feel that health should not be seen as a human right or should not be given opportunities for all. Yet our World Health Organization emphasizes universal health care is the right to health. And National Association of Social Workers emphasize social justice and social change, and underscoring that we should all have access to health. Think about medical needs. Think about how important that is to our life and our changing world that we live in. And also there's a lot of focus changing on healthcare, and this is where I think we as social workers can do much more. We sometimes always are into the end, looking at outcomes, but sometimes we don't spend enough time looking at the prevention. And prevention, we spend 75% on preventable chronic conditions, yet 3% on prevention and public health. Social workers, our life model of person environment, understands the importance for the individual, the family, and the community, and how we can enhance one's health. So the areas that have to be debated and you hear about is access to health care, understanding this large gap in health coverage, the continuum of services, making sure people have access to a wide range of services, from being, many older adults that I have worked with over the years have emphasized, I want to stay home. I want to be able to live and grow old in my home. Yet the roof may be collapsing because they don't have the ability to pay for the shortages in their home environment, the need for repairs. And this cost, how do we deal with multiple layers of costs attributed to helping someone stay at home, helping individuals live the life they want to live in the environment they want to live, and address, maybe there's some programs out there that could pay for wheelchair ramps, that can pay for repairs. So maybe not keep individuals and into an institution where community-based programs could be offered. And then also, we have to recognize, and this is, I think, it's so sometimes easy to say, oh, I've got a quick fix. We have to empower individuals to see what their choice is, because not everyone chooses the same thing. I am fascinated. I've done a lot of work in palliative and end-of-life care, and what somebody wants at the end of life is very different what another person wants. And you have to make sure that everybody can give their own choice to health, because what I may choose, what you may choose, may not be the same thing. And so I think when we think about the right to health care, we have to think about the right to health care for an individual, and to be able to inform individuals about the different options and choices they may have. And this is, when we look at all the different platforms, is the importance of understanding equality, understanding outcomes, understanding prevention, and how prevention can improve life, and to make sure quality of life is the utmost importance for those of individuals as they age throughout the continuum. The focus in the field of healthcare has been changing. Before, we have not done enough to advocate. I think you see and hear a lot about advocating for human rights, but we also need to do more to address healthcare disparities, because that very uneven balance, what we say overall infant mortality in the United States may be acceptable, but for certain racial and ethnic groups it is below other countries. We have to address healthcare disparities and ensuring the right to equality and access to care. And I think this parallels very much with our NASW, thinking about ethics and our ethical principles, especially around the principles having to deal with healthcare related to distributive justice, need, compensation, and as well as contribution. So when you look at your NASW, our code of ethics, when you're examining them in your classes, think about them in terms of health. Who has right to access health, and how do we have that in our environment? And this comes up, autonomy and freedom, self-determination, a very important issue with equality and inequalities, addressing privacy and confidentiality, and really overall understanding issues that individuals may face. And sometimes when we think of healthcare, sometimes people feel shame. Like, there's many older adults say, I don't want to tell them that I'm starting to forget. I'm starting to be scared. And how do you say that's acceptable? How do you as social workers deal with working with different populations in the way their belief systems is, that it may be difficult for them to understand and accept? So we have to be able as social workers to balance the quality, improving access to care, but also building a sustained workforce that is trained. And the reason I came here today to talk to you is I always think you're practicing in child welfare, you might be practicing in aging, you might be practicing at a family center, but health issues cross all areas. And how do we have a workforce that is trained to understand health, to be able to talk and be able to listen? Because part of what you're learning in your classes is you need to be an active listener, because you can't think about what it is for your situation or someone you know, but you have to listen to what the individual or the family member is saying to you about their health and their concerns. And even though you might say you may have fears, those fears are real for many individuals. For many family members, they may be uncomfortable talking about Alzheimer's disease, or they may say they don't want to talk about what they want at the end of life. But at the same time, for many, they might want to do that. They might want to make sure we've got to be able to empower individuals so they can be knowledgeable about that health issue and be able to make the decision that they want to make for their choices. So how do we address all these issues in practice? And the challenges go back to understanding and respecting the right to self-determination, and understanding there's not a quick fix. Healthcare is complex. Healthcare has many layers. Healthcare and one's health affects not just the individual, it affects the children, the grandparents, the family around. And so I always think of that Verizon commercial, that when they stand and they say it's a family member and this is my network, and you see all these people standing behind the individual, one's person health, whether they're being diagnosed with cancer or they're being diagnosed with Alzheimer's disease or whatever the situation, it affects the lives of everyone they've been involved with. So when we think about health, it is a complex issue. It's complex for the individual, not only the issue of treatment, the issue of where to get help, how to pay for it. How many times have you said, oh wait, is that provider listed under my health care insurance plan? And for many people, they don't even have providers that are listed. The list may be too small, or the list may not even be there because they may not have health coverage. How do we address the practice with diverse populations? And how do we realize the practice across the lifespan? I don't have all the answers, but I think it's important to realize there's a lot of issues. We hear about intersectionality. When one person comes in, we have to understand power dynamics. We just did a training with older adults about how to communicate when you go to the doctor. How to ask questions. Do you know how many times many older adults are on average taking over 5 medications a day? Yet we're asking not only for them to track their medication use, we're asking for them to understand, is there any issues with the medication use with something they may buy over the counter? They're having trouble sleeping. Is there an interaction? They may not even know about some of the dangers, how to talk to your physician, how to talk to your pharmacist, how to talk to social workers about some of the concerns you may have. And so these is understanding, and those older adults, they may say, oh, I listen. But you have to say, go in with a list, raise some questions, raise some concerns, because yes, these are medical issues. Yes, you need to be concerned, but you also need to understand and be knowledgeable and ask questions. it's okay to bring a loved one with you if you're not able to articulate some of your concerns. Maybe come in with a list of 5 questions. You know, I think sometimes myself, you know, you go for an appointment, you say, oh, I just want to ask this. But then all of a sudden, I walked out the door and didn't ask the main question I went in there with, right? And then you have to wait another month or so for a future appointment. So how do you prepare people to talk and address healthcare issues? There's been a big growth in behavioral health, and integrated behavioral health care is working with all areas, having to work not just with one physician, but working with a team of physician, nurses, and social workers that practice and ideally discuss the issues that come up with a case. We hear a lot of this about promoting access to collaborative treatment. There's an impact study that has been done with many older adults, and there's patient-centered medical homes that are being used as a way to address patient-centered care for shared decision-making and addressing outcomes. And in that move for integrated health care, social workers are right there as team members. You, as you're looking for jobs when you graduate, many of you will be graduating in May, right? And you're going to be looking for jobs, and teamwork and team practices in many of the clinics and agencies is building. How social workers are prepared, you're doing the screening. You're involved in the assessment, right? You're learning all about assessment. How you can be involved in care planning and care coordination, working to intervene, whether providing services of intervention. Cultural competence is critical, but you as a social worker are part of a team member in many integrated behavioral practices. So when you graduate, you'll come back and you say, wait, I got a great job in healthcare. I got a job being part of an integrated behavioral health team. A student that had graduated about 5 years ago, she was telling me about all the work she's doing, and I thought, wait, I should be bringing her here to talk to you because she is leading future social workers and working with, you know, many different clients right here in Westchester, and then she has, the agency has a practice in the Bronx. So we have to kind of think about how we integrated care. There's a lot of work being done in primary care centers that are coordinated. There's also co-located care. And then there's total integrated care where you have many behavioral health care networks working together. And to be aware of different screening and assessment tools, how many out there, think of it, you out there as well, have learned about the Beck Depression Instrument? Raise your hand, just want to get a sense, right? We need to know more. The PHQ-9, it's a very big instrument used in all our clinics. The GADS, the CAGE and the audit, drug abuse. Do these sound familiar? They're very needed because they really help us to identify and in many ways assess areas that have to be done. So how we can collaborate, build, and strengthen assessment is critical. And this does not, and I'm sorry that slide kind of hides there, but this is throughout not just working with individuals, but working in meso and macro. I think there's been a move. How many of you are looking at macro and policy issues as well in your classes? A couple of you are taking? Hopefully by next semester you will be learning more about issues on building new policies for healthcare and integrating health interventions aimed for social workers to do community needs and community health assessments, developing programs to assess the underserved. So I know it's about time that we need to end, but I just want to remind people that as you think about practice, you also should think about policy. Because if we're not going to change anything unless we have the policy to do it. So we have to build demonstration projects. work on interdisciplinary teams and have policies that work on that, and implement strategies to improve health. Eliminate, well, this is a big thing about cost, issues of aligning payments and what we call carve-outs, and really focusing on changing policies. And guess what, my research students that are in the room, policy also is done by building the research, having the research to affect policy change. So when we think about practice, think big. Think about policy and think about the research that can inform changes for our healthcare policy. So thank you for coming today, and if there's any questions, come up afterwards and